Ji, Assalamu alaikum, everyone. Thank you for joining us for this Saturday evening in Pakistan and morning here in US. We really appreciate all of you as you have traveled with us on this journey to find out the landscape for research as well as healthcare innovations and ideas in Pakistan. Because unless we find where the things are, where the leadership is, where the leaders like Dr. SHAHZAD, our speaker today, are and what they're doing, we cannot collaborate with them. Basically, it's our journey and exploration to find people and partners in Pakistan so that we can have collaborative programs, collaborative medical education research, healthcare innovations. So I really appreciate this group and cohort which have traveled. We are, I think, more than halfway done, but still there's a lot of interest from Pakistan to present their journey or achievements that they have done. So let me introduce and welcome my dear friend and brother, Dr. SHAHZAD Ali Khan. He's a graduate of King Edward Medical College in 1991. And after his MBBS, he did MBA with major in finance and master's in healthcare, public health from Qaid-e-Azam University. And he's one of the very few doctors who have additional PhD degrees in management sciences. He has been a distinguished faculty and fellow from Royal College of Physicians and Surgeons of UK in public health, as well as he's a fellow of Royal Society for Public Health, London, UK. He has over 28 years of experience in administrative work, management work in from secondary to tertiary care level healthcare facilities, and his professional expertise varies from health system analysis, health system management, policy planning, strategic planning, governance, health economics and health financing, health reform, civil society organizations, project management, and human resource development, both in public and private sector workforce. It seems like he's the person that Pakistan and we outside Pakistan need. In addition, he carries a vast teaching and research experience, both at the undergraduate and postgraduate level in the field of health financing, project management, system and policy development, corporate governance, health economics, and quality management at national and international level. He has been involved and has contributed in development of several national, international strategies, policies, working papers, training manuals, and policy papers. His research work is extensively disseminated through more than 130 peer-reviewed publications in national and international journals. It's my great pleasure to invite, now he's the Vice Chancellor of Health Services Academy, and he will take us through a journey how the Health Services Academy was formed from its inception to excellence. Welcome, Dr. SHAHZAD, please take over.
Thank you, Dr. Shahid, for such elaborative and very nice welcome. It's my privilege to be talking to most of the sort of friends and colleagues and a lot of other medical professionals in various areas of Pakistan and USA and Canada. And special thanks to Shahid Saab and Uzair for arranging this activity. I'll just initially go with a small PowerPoint presentation. Although the people who know me, they know that I do not like doing PowerPoint presentations. It's mostly a sort of an impromptu talk. But later on, after having this, some of the numbers and some historical things, getting through these, then we can talk about how and what can be done in Pakistan and how we can improve this health system and public health system in Pakistan. You can hear the noise outside. We are celebrating by horns and crackers, and a lot of noises will disturb. Hopefully, I am in the center of my house, but still there will be some distortion, and due to some overload, there is also a chance of load shedding. But I have a backup system. Inshallah, we will complete this. So the topic of today is, as you see the monogram of this Health Services Academy. I'll just start with the brief background, and first of all, I have to disclose that I do not have any conflict of interest and any financial relations with reference to this CME activity. I actually assure you for that. When we talk about the background and evolution of Health Services Academy, Waleed, आपको ये slides clear नजर आ रही हैं?
Yes.
So the Health Services Academy, as many people don't know, those who have been here, they understand the history of this Health Services Academy. Otherwise, many people, they don't know that this is something which is established since 1988. Since 1988, it is established for in-service training. So like you see the Civil Services Academy, the National Institute of Public Administration, the Armed Services Academies, on a similar grounds, it was developed for in-service training of the public sector doctors, and in some cases also for the nurses. So initially it was only pure medical, clinical fraternity for trainings over here. They used to come in 88 and then they will go back into their departments, and it was a federal government, the whole area of Pakistan was under its domain. In 1994, people over here in academy, they thought of that many students, they are interested in doing masters and diplomas and courses. So they got affiliation with the #1 university in Pakistan at that time, and I think still Kazim University is one of the top universities in Pakistan, and we have a very working relationship with them. 1994, this academy got affiliated, became the affiliate center of Kazim University, and they started working on a master's program, diploma program, and certifications. So the first program was launched in 1996. It was 1-year MPH. So the alumni of those 1996 MPH program, some of them are sitting in the World Bank and Asian Development Bank in Geneva headquarters, and some are here with me, 2 or 3 who are as professional sort of professors over here. They did their PhDs later on. So all of the initial faculty and the initial alumni, they are well settled in various places of the world. In 2002, we attained an autonomy. By what it means is we were a part of we were in sort of a department under Federal Ministry of Health, but we were given autonomy to take decision. There was a board, governing board, and a lot of autonomy was given to this academy. And this actually kick-started a kind of a revolution when started doing the alumni as well as the administration and faculty. They started doing things more independently, and this was the time when I came here as a student. So I am an alumni of 2002 batch when this autonomy bill in the assembly was passed. Since 2002 to 2018, it served as an autonomy, but still under the Ministry of Health, there were the more sort of role was the Health Ministry was still part of the governing board, but we got full autonomy in the form of a government which actually made us a degree awarding institute. So we are now a degree awarding institute, just one step short of a public health university. We are a degree awarding institute with one department of public health and other units in that. The act was passed in 2018, but in 2018 the government changed, and it took some time for the government to appoint the first vice chancellor, and luckily the Director General Health, Dr. SHAHZAD, who was all efforts behind this degree awarding status, and degree awarding structure, and who took Health Services Academy from 2009 to 2018. He was made the first Vice Chancellor, and the thing started rolling out, and we started our own programs and a lot of other activities. So I'll show you, this is just a little bit of background. So just to show you, this is the plaza, small plaza. It was labeled as Bevel Plaza, in which we used to come. Within these shops, there was a sort of a stairs. Usually the lift was not working, and we used to climb to the second floor and third floor, which were for Health Services Academy. So the academy in 1988 was started in a very shabby old commercial plaza of the Blue area in Islamabad. And look now, in 2006, this was the reshaping of this academy into a purpose-built building with 3 different blocks: academic, administration, and lecture hall, and other student affairs. And also the land was enough, and now we have started expanding this as well. So it is around 7.5 acres, a lot of hostels over here, hostel facility, residence facilities here. We have houses for staff, we have houses for professors. So inside a purposeful, sort of a purposely built campus, the academy was shifted in 2006. And since 2007, we are having 2 years MSPH program and a lot of other program. I'll show you later on. The Act of Parliament gives us 3 main. Waleed, aap slide nazar aa rahi hain?
Yes, I can see.
कुछ मैसेज में किसी ने लिखा हुआ था कि स्लाइड शो नहीं हो रही. So the Health Services Academy is mandated by Act of Parliament of 2018 to do training in health, and if you read on, I think it covers everything which comes under public health. So we are very much a whole diversified act in which every area is covered very nicely. So when it comes to health, it can be clinical or non-clinical, administrative, animal sciences, biological sciences, biotechnology, and any discipline that it considers appropriate, which covers everything. So allied disciplines produce competent, imaginative, skilled, and committed health professionals. The second one is we have to have sort of an examination system, and third one is very important. Look at the third objective: to provide policy advice on public health, research, health education, and related discipline to federal government as deemed appropriate by government or HSA from time to time. So this has a very high sort of role, which gives us these 3 objectives. So the 3 objectives are public health profession, and public health, by public health we mean all biological, medical, clinical, administrative, non-administrative things, and new knowledge and research production. And third one is sound evidence-based policy and practices. So this is how we evolved from an in-service training institute in 1988 to 2018. After exactly 30 years, we got hold of almost every aspect of public health and health system into this domain. If you see, this is a chronology of various programs. We had started MPH program in 1996 with Kazim University, but after 10 years, it was discontinued because of HEC regulation that the MS program must be launched, the master's program should be. And I think HSA was the first to take this forward. HEC is still trying to implement this concept of stopping this master's program and start a system of BS and then MS and then PhD. So we had MPH and then MSPH since 2007. We have FCPS programs in 2007. Our PhD program, the first entry was taken up in 2012. Health economics and management program was also started in 2009. A few batches, they were passed initially, and then medical entomology and disease vector control, keeping in view of the dengue and other leishmaniasis and other vector-borne diseases. We started a diploma and an MS program in it. Human resources in health program started in 2010, was associated with Queen Margaret University, Edinburgh, and GIZ supported us, and we had been doing this. Since 2020, last year, we are working on a program of family medicine. I think we had a lot of discussion with APPNA, Merit, and other colleagues in RMU as well. And then WHO finally supported us, and we have a certificate course of family medicine has passed, and they are now into the diploma program. So we have a diploma in family medicine since 2020. We have 3 cohorts passed on health insurance management. You know, this the Sehat Sahulat program is very much into Pakistan. It is a social health protection program which needs trained managers. So we have trained 3 cohorts, but the next cohort is now enrolled, and hopefully by 20th August we will be having another classes of health insurance management diploma. I'll tell you later on how we ended up in the critical care being a public health academy, but we now have a critical care training program for ICU care and other sort of advanced level and basic level, both courses with various universities and various hospitals of tertiary care. This was in lieu of COVID. Hospital management program, we have started a diploma in hospital management, which will be converted into an MS next year. We have a lot of online courses. If you see the website of HSA, which is very simple, hsa.edu.pk. If you go onto the HSA website, you will find a lot of online certification programs. We started those programs when we came to know, and I think COVID told us that many things can be done online. You don't need to be physically there for some of the things. Of course, physical presence is very good, but there are many things which are still possible if you want to go online. So this is a long list of programs over there on HSA website, and there are some purpose-built, customized courses for various needs for different of our donors and partners and organizations who work with us. We customize various courses of public health and health system for training of their healthcare provider and also non-health providers. Mission statement is simple: to serve as an internationally recognized center of excellence in the public health, contributing to health and social well-being of people of Pakistan. So our domain is all over Pakistan, although we are based in Islamabad, but we have a lot of connections with and formal linkages with almost all the provincial health services academies. We have MOUs and letter of understanding and collaborations with almost all big universities dealing with the public health trainings and teachings. Governing structure after this Act of Parliament of 2018 is simple. We have a Senate which is chaired by the President of Pakistan. So in that sort, the President of Pakistan being the chair of Senate, we have highest political as well as administrative power attached to academy. A lot of decisions, they go through the cabinet and then reach President House. So if the President and the Senate approves it, there is a lot of power in that decision. The second is syndicate, which is chaired by the Vice Chancellor, and there is an executive body. Day-to-day general supervision and managerial functions are done by a syndicate. And we have academic council, which has had several, to date after 2018, we have had a lot of academic councils meeting as well. We have had 2 meetings of the Senate as well. So this is something which is the governing structure of all the universities we have. Some universities do not have Senate, but in HSA we were lucky to have Senate, and then President as its chair. This is some of the glimpse of full-time faculty of academy. Some of them are sort of, most of them in fact are internationally trained PhDs, professors, associate professors, assistant professors. I can easily say that in any public health department in Pakistan, HSA has one of the highest number of PhDs teachers and highest diversified group of teachers in Pakistan. I can challenge easily that you just count the number of PhDs working in any other public health department, and you will see the difference. Look at this, 5 and then 8 and then 10. We do not even take a non-PhD as an assistant professor. The minimum entry requirement in HSA for an assistant professor is a PhD. We have lecturers who are enrolled in PhD, so they will be, some of them will be also completing PhD, and then they will take the role of assistant professor. We have a lot of research associates as well. Some of them are on campus HSA, and some are busy in various research assignments which HSA is doing nowadays. So this is one department of public health, and within that we have health system, we have epidemiology, we have biostatistics, we have anthropology, we have MNCH, we have HRH, we have Global Health Department with University of Manitoba. So there are multiple departments, but as the degree awarding institute was given to HSA for one department, so we just call it as a Department of Public Health. But I'll tell you later on that how we will be improving it and increasing the number of departments to become the National University of Public Health. This is something which we have done so far. HSA had always been a part of health policy advice. I can assure you for the last 10 years, all the national health policy, provincial health policies, HSA had been an active part. The National Health Vision was developed inside HSA. The Punjab Health Sector Strategy, I was a member of that. In KP Health Sector Strategy, I was one of the reviewer and participated in that. Sindh, Dr. SHAHZAD was working, but we had a lot of liaison with them, Aga Khan. So health policy and strategy development, HSA is a key. Immunization strategy, social health protection. This is important because Pakistan is moving towards this Sehat Sahulat program, and it was formally called in the last government, the Nawaz Sharif government, it was labeled as Prime Minister National Health Program. So that PMNHP was renamed as Sehat Sahulat program, and because in KP, the PTI government had called it Sehat Sahulat program. So in overall Pakistan, we have social health protection program by the name of Sehat Sahulat program. And this was conceived, piloted, conceptualized, and then launched from Health Services Academy. So HSA was a secretariat for the Sehat Sahulat program. We did the baseline survey of Sehat Sahulat program. I was the team leader. We did the mid-line review, the mid-level assessment of Sehat Sahulat program in Pakistan. I was again the team leader in that, along with Dr. Asad Hafiz. And then now I proudly sort of announce informally, we are waiting for the formal letter, that the third-party evaluation of the Sehat Sahulat program has also been won by through a bidding process, negotiation, contract. We fought with all the other competitors, and we have been lucky to have highest scores, and we will get the third-party validation of Sehat Sahulat program in Pakistan. That would be a great sort of learning exercise for all of us. I'm anxiously waiting for that to see how this 10 years program since 2012, 2013, how did it affect the out-of-pocket spending in Pakistan. The various strategies of malaria, TB, HIV, because we work with the Global Fund. You know, there is a country coordination mechanism of the Global Fund. So the country coordination mechanism secretariat is based in Health Services Academy. So when anything coming from the Global Fund, HSA is a part, and HSA is also the part of the oversight committee of the Global Fund. So we have a very powerful place in funding what it is coming to Pakistan. We have been working on a lot of quality of care trainings and standardization. We were part of MSDS, Minimum Service Delivery Standard, and in KP they developed some quality standards through the collaboration of GIZ. So HSA had been part of these few policy level things. Coming to COVID, as you see, for the last 1.5 years, we have been all the world is suffering from COVID response, COVID response issues, I can say. Every country tried it in a different way, but HSA was in the forefront because the head of HSA at that time was also the DG Health. So Dr. Asad Hafiz, being the DG Health and the executive director of HSA and later on Vice Chancellor of HSA, it came to us, the COVID response. So HSA became one of the core member of the National Command and Control Center, NCOC, and we from the very first day in March, on 26 February, the first case was reported in Islamabad and one in Karachi. I think 3 in total on 26 February. Since that day, HSA had been involved in all the COVID-related guidelines. And I think more than 160 guidelines have been developed. If you go to the website of NIH, or you can go to the website of Ministry of Health, you download any COVID guideline of Pakistan, go to the last page, and you will see the name of Health Services Academy written on it alongside NIH. So every guideline, every training, every survey, related to COVID, and every sort of support system which was developed for COVID, the HSA team was part of it. We had few classes at that time that were called off, and whole campus was made a secretariat for COVID response. So the PPE training, vaccination, ACSM, advocacy, communication, socialization, and behavior change communication, they were all. So we have trained more than 100,000 community health workers to date in COVID response. Intensive care was considered as a very serious area which we were lacking. We had very little intensivists. So what we have done is we have trained over 10,000 doctors and nurses in Pakistan on ICU care. So you can imagine the improvement in the hospital outcomes immediately after the trainings, because the trainings were done by one of the best in Pakistan. All the CPSP approved supervisors who were training on behalf of HSA. So that critical care training were very essential, and we did good in that. We also partnered with Aga Khan University for assessment of intensive care as a baseline on for government, as well as they had the project of intensive care assessment, because one of the best intensive care services are of Aga Khan. So we partnered with them. We supported them in data collection for all various 650, I think 650 or 648 big hospitals which had high dependency units or intensive care units. So we did a baseline assessment, and then they were refurbished and they were improved, and HR was also trained. There are so many training for testing, tracing, quarantine. Initially, initial response was to test, trace, and quarantine. All these TTQs were managed inside HSA with the support of NIH, because the team was from NIH and FELTP. This is field epidemiology and lab technology. They were very sort of coordinated. They were coordinating everything, and HSA had some trainings in combined. We have an RMNCH portal in lieu of COVID-19, and it's a very big resource center. Safe Motherhood, Forum for Safe Motherhood, and White Ribbon Alliance, they partnered with us for MNCH care, because MNCH indicators are very poor in Pakistan. So what we did was we partnered with some motherhood organizations, and we did that. If you see, we have this is something which we have recently for the last 2 years developed as well. We have a global health department which has been which was last year, not last year, 2019, because 2020 we didn't have the conference. In 2019 we established a global health department through the collaboration of University of Manitoba. So the staff and faculty of University of Manitoba sits inside HSA, and we have a lot of research projects and trainings, and they take up epidemiology and other trainings of our students as well. We have a health insurance management course already mentioned. We have a national level collaboration with all the ministries, federal and provincials. We have a health policy think tank. Our collaboration is with almost all the major universities. Recently, we signed an MOU with WHO, in which 9 other universities have signed a memorandum of understanding with HSA. So we have partners with all provincial health services academy, Institute of Public Health. I think last 10 days ago, I went and renewed the MOU with Institute of Public Health Lahore. It is one of the largest public health institute in Punjab. The Quetta team was here, and we have an MOU in pipeline with Balochistan. We have an MOU with Provincial Health Services Academy, KP, and we are working with Bakai Institute as well in Karachi for NCDs. These are some of the international collaboration. I will not read all of them, but Cambridge is there, Liverpool is there, Heidelberg is there, Bradford University is there, London School, Manitoba, British Columbia, Canada, Chinese University, Hong Kong for basic training, University of Washington for DCP3 and Essential Health Service Package, University of Indonesia, University of Cambridge, and TUMS, Tehran University of Medical Sciences, Baltimore University. So these are all, and Gates Institute. Actually, these are all active collaborations, active products, active things going on in HSA, various trials, various projects going on in HSA in collaboration with these universities. So we have a faculty exchange as well as researcher exchange, and a lot of data sharing partnerships with these institutes. these are some of the development projects. I already, I think, mentioned some of them. The surveys of health insurance, the health insurance management cohorts, trainings of ICU, long-term institutional grant. This is a very big assignment with WHO, third year, second year grant, and we are now again for ICT. ICT is Islamabad Capital Territory. So for Islamabad Model City project, the service availability and readiness assessment, SARA. The service availability and readiness assessment survey was done by HSA. It is near to completion, and it is replicated in all other parts of Pakistan as well. EPI trainings of vaccinators was needed because of the issues of vaccination and a lot of immunization related issues. So HSA is taking care of EPI training through the collaboration of UNICEF. And we have developed a lot of modules. I already mentioned that you just see, you download any guideline related to COVID in Pakistan, you will find the name of Health Services Academy written on the last page. We are working on HRH registry. We have trained a lot of healthcare workers, UHC benefit package, countdown project report is there, evidence for better lives is there, EBLS, and then population-based zero prevalence surveys of the COVID disease, as well as some measure of how many people have sort of an antibody against COVID. So we did that when we were testing less. So we had a support in which we did population-based survey to understand the prevalence of COVID in the population, because testing was done only for the contacts and the symptomatic cases. HSA, another thing very important, we told you a lot of things, but remember, the 5% of financial contribution is coming only from government of Pakistan. So we are not fully funded by the government of Pakistan. The whole budget, total budget is contributed by a token money from the government of Pakistan, which is not more than 5%. The remaining is coming from various courses, diplomas, masters, certificates, conferences, as well as research and development, and some of the major donors like USAID is one of a big donor in HSA, JSI is an international NGO, and there are funding from Germans, GIG, and funding from Asian Development Bank, and also from World Bank and UN organization, UNICEF and UNFPA, to name a few. These are some of the faculty members, and I am just talking about the publication in last 1 year. So I'm not talking about the whole number of publications which are available on our website. You just click the publications against each faculty member, you will find. So this is the number of publications which is done in 1 year in HSA. So if you can see, there are, and I think some might be missing because in process articles and others, I wasn't able to get hold of all of my faculty members to share the details with me. But you can see in 1 year, 36 international publications were done by HSA. And on the other side, on the right side, if you see the PhD and MPhil students. So PhD in public health is a 3-year program, and currently we have 28 PhD fellows. Almost 6 of them are near to completion. 5 of our students have already passed the PhD program. 2 of my students have completed PhD. Dr. Asad's students have been completed PhD. Dr. Syam Sikandar, Dr. Zahid Bhatt in USA, they have completed PhD. And others are in process. We have an MS in public health morning full-time 2-year program. 129 students are enrolled currently. There is an evening program with 36 students, and there is another evening program with 28 students. So there is a last year, because of COVID, a program was delayed, and they will be given degree this year. 18 students are pending because of their thesis and other issues which were delayed because of COVID. So there are around 239 PhD and MPhil level students, which is a very big thing currently on campus in Islamabad. We have our own journal, category Y, recognized by HEC and PMC. And this is very good for, giving access to publication to through, of course, an open system of Scopus and other you can see guidelines, basic author guidelines. We have our own journal of public health. This is the only journal of public health in Pakistan. We have almost completed all the criteria for Medline indexation. So my next target is to get it indexed in Medline, PubMed, and then go for a JCR impact factor and increase its utilization and disseminate it so that people read and they also refer to this journal. HSA outreach strategy, as I mentioned, we are working on these lines. So what we are doing is we are developing partnerships. You can see on an HSA website as well as on social medias. Every other week, we have a partnership agreement with a lot of relevant partners. We are going national. We are opening sort of partners. You can call them sister or brother institutes in other organizations where there is a weakness of HSA. We are partnering with those community-based organizations. And I think President asked me to do something at the community level as well. The field demonstration area at national level, digital health, online teleconsultation, and a lot of other things, which I'll discuss later on. Today is just about this HSA future approach, multi-channel, lasting partnerships, sharing resources, mutual benefit with partners, and greater awareness about HSA. You will see HSA's social media presence soon, because we have now got hold of a communication team as well. So inshallah, we will be more visible. Whatever we will be doing, we will be showing it. We need to increase the current public health programs and courses. Within this year, we have done quite a lot. The number of certificate courses online have reached almost 34, 35. We have a distance learning program. Then there is a on-campus program as well. Provincial health departments, this is a commitment with USAID and with the governments of provinces. We will be strengthening the capacity of all the provincial health departments, especially their health services academies. 4 to 5 new departments will be there, inshallah, by the end of next year or early 2023. One will be the health insurance management, reproductive, maternal, newborn, child health, a separate department, family medicine as a new separate department. And I can think of a family medicine and clinical training programs as a separate, and it will be run by most of the clinicians with a good knowledge in public health. We are hiring. On Monday, we have interviews, and there will be some almost 10 new PhDs or MRC GPs or FCPS community medicine and family medicine consultants will be joining, inshallah, by the end of next week. Biostat, epidemiology, and there is a need of having a separate digital health portfolio in HSA, and we will take the lead in digital health as well. Ultimately, after having these at least 4 departments, we already have 1. We need 3 more, but we will make at least 5 more. So with 6 departments, we will become a National University of Public Health Sciences. This is the 2 days ago, I presented the business development plan, which I just showed you. You can see on the upper picture, the 2 red books lying on my left hand. I presented to the Honorable President, and he's the Chancellor, and he appreciated, and he also guided us on what to be done next. This is, you can see the Special Assistant to Prime Minister, the Minister of Health, and the Parliamentary Secretary of Health inside HSA, and we are having a debate on COVID-19 vaccines, strategies, enhancing coverage. This is, you can see the head of NIH with the Director General of Provincial Health Services Academy, KP, with General Salahuddin Qasim, the board member in various hospitals, the National University of Medical Sciences professors. You can see the WHO head with us, the DHO Islamabad is with us at HSA. The Ministry of Health director is here, the DHO is here. So we have been doing a lot of, and this is the, you can see the picture of NCOC, which is shared on their media gallery. Otherwise, we are not allowed to share any inside picture, only what they release, we can refer to them. You can see the special assistant sitting there, the other members and partners sitting there, and the provincial chief secretaries sitting there. So we were lucky to have this NCOC. Otherwise, the things would have been very different in Pakistan from the first day. The whole civilian as well as military. So we actually fought the COVID war in a military style. We opened up, we kept the economic activity going, and we strategically locked down the areas which were of high concern, and then we utilized all the forces available in Pakistan, the civilian as well as paramilitary and other, and that is how a war against COVID can be sort of managed in a developing country. We didn't have enough testing kits. We didn't have enough HR. We never had any good hospitals and ICU care. The only thing we could have done was to protect at source, to prevent at source, which we were able to, and you can see it was appreciated globally. Currently, also, we are passing through a very critical phase of this Indian Delta virus, and we are trying to keep pace with it. We are still hoping to get it covered, inshallah. I'm very hopeful because I am myself, you can see me sitting there, I myself attend these meetings, and I know the inside story that everybody is so committed, and everybody takes care of all the information which is there. So this is what this is. You can see the DRAP team on the above one. Dr. Rashid Saab is there. We have a training. We have a we have MNCH, so we do a lot of family planning and other budgetary allocation consultations with us. The polio eradication team with us. You can see the HEC, the member HEC and the DG HEC. HSA is a partner to a lot of these organizations. The minister is here. This is PMC. I visited PMC to talk about some of the you can say certification of public health courses, the clinical courses, and a lot of discussion was done. And I think we are on the right track. Whatever we will do, it will be shared with HEC, with PMC, and we will go by the book. And inshallah, we will be able to solve. This is a Balochistan group, the parliamentarians, the ministers from Balochistan, and we are very much interested in upgrading the health system of Balochistan. In the above picture, you can see the WHO head of mission in my office, and we are very good working relationship with WHO in Pakistan. We have some grassroots initiatives working in various areas of Pakistan. They are partner for data collection with us. We have a very good partnership with the nutrition activists. So in Pakistan being a malnourished and a malnutrition burden country, we need to do something about it, and that's what we are doing. We are a partner, very active partner in all the nutrition deliberations in Pakistan. I myself always attend any nutrition activity, advocacy, or any policy level dialogue. I do that, and my faculty members, enough of them, I think 5-6 members are trained in public health nutrition. We have very good relationship with the Armed Forces Postgraduate Medical Institute. This is an outgoing batch. They completed the training and they will go into the field and they will serve the people. In the end, I think this is my last slide. In the end, I will request all of you to go to the HSA website. The website is, I already told you, just write Health Services Academy Islamabad in Google, and it will take you to our website and all the linkages. We are having an annual public health conference next month, 22 to 23 September. Although the date written over here is 15th August as a last date, but I will try to accommodate as much as abstracts and interests are there by 20th August. So we will try to accommodate any ideas, a brief one-pager. If you can send, it will be great. If anyone wants to join physically, because by the end of September, we are hoping the COVID will be manageable, inshallah, because now we are in a lockdown phase. So it will have, in 2 weeks, it will have a positive impact and things will move up. Otherwise, we are already doing it in the open area, outdoor area, and also connecting through online. So all the US, Canadian and EU and all overseas can join online. We have an excellent online IT system in HSA. When I joined, I specifically focused on improving the IT infrastructure of HSA, and we will be doing some more towards that. So I actually invite you, all of you, to join this conference, be here if possible. And we can also through APPNA and through this Canada Pakistan Research Development Forum, I think we can have, I can talk to Shahid Saab and Uzair Saab. We can fund a few good resource person if they want to come here. We can always support their travel, boarding, lodging, and we want a good outcome of this conference, because you know that the topic of this conference is access to medicine. So contemporary medicine, medical technology, and vaccines are one of the biggest, you can say, future investment, especially in vaccine and public health prevention. This will be a very interesting debate, and we will share a lot of good news with you, as well as a lot of research which is coming up. Already many papers have been submitted, and there is a huge interest by most of the partners in participating in this. So you can see a good version of this call for abstract on the website. I just took a screenshot and pasted it here, but it is there on HSA website. I think this is all from my side. I deliberately left 15 minutes as ordered by Waleed Saab, so that we can have some discussion. Over to you, Shahid Saab and Waleed Saab.
Ji, thank you. Very informative, although some of us knew about your contribution as well as HSA and public health in Pakistan, but I think it was really, really enlightening to hear all the other things that you're doing and your plans. One thing, before I go to the our worthy panelists and invite them for their comments and questions, as well as take questions from the attendees. My personal question is, when you mentioned about Balochistan as a province that you're working with, is there some law changing? Because what I knew that federal government does not have much authority on the healthcare of provinces.
Yeah, you are talking about the devolution issue. So what we have done is, through the composition of our Senate, through the composition of our syndicate, and through the sort of a combination of various agreements which we have with the provincial departments. HSA is one of the main department in the federal government which can actually go and work in the provincial area and the districts, and we are currently working. So I think this is very important that somebody in the national level institution should be having access to for collaboration and others in Pakistan. So HSA is the one. We have all the mandate and all the, you can say, support for supporting our provincial academies as well as health departments. Answer is yes, Dr. Shahid.
Yeah, thank you. So you also mentioned about digital health, and also your purview, as I see, of your university and yourself is on the performance improvement and quality assessment. And we have in our panel a great member of and chair of the IT committee, subcommittee in APPNA Merit, Professor Sarwat Hussain.
Yeah.
Sarwat Sahab, please go ahead to explore some of these digital avenue and if the HSA has any interest in quality assessment and what can be done more in terms of quality improvement. Go ahead, sir.
Thank you, Ji. Assalamu alaikum. Very, very enlightening and very enthusiastic presentation. I can, from your tone of presentation, I can tell you are a very motivating leader, mashallah. And obviously you have multiple venues of cooperation and collaboration. And incidentally, I'm also a KE graduate. I won't tell you which year, but nevertheless, I was, my question, Shahzad Saab, was that I'm become very interested in artificial intelligence, especially in healthcare, and I've written a little bit here and there. And I think especially for the universal healthcare delivery and other care deliveries, artificial intelligence is going to be the vehicle, and to some extent, level playing field between the high income and low income countries, because in our country, especially, if you will, the labor is less expensive. The youngsters are exceptionally bright and intelligent, much higher intelligence than the Western world. And this is the time, in my opinion, that if we, through your academy, take the lead in artificial intelligence in healthcare, that we can become world leader by year 2030.
You know,
And
already, yeah, please go ahead.
So I really think that artificial intelligence, and I'm sure you also know that President of Pakistan Initiative of Artificial Intelligence and Computing, PIAC, is also one of the organizations that I think is trying to do that, but I'm not sure whether they're making a tremendous effort. And it looks as if your organization and your personality is perfectly suited to take us to the leadership in AI in medicine by 2030, by which I think you still be a young man.
Thank you, Sarvat Saab, and good to know that you are a Chemcolian, and you know, once a Chemcolian, always a Chemcolian, we used to say when we see each other. I think IT is in my, you know, my own personal, you can say, likings. I loved working on most of the softwares and with IT, and I think in 2000 or 2001, when the medical transcription started coming in, we came to know that a lot of Pakistani paramedics are also doing this medical transcription. Then there is a telemedicine, and then there was the CPOE, and then CPOE with CDSS. So I was following since last 20 years, but we in Pakistan waited for COVID to understand the importance of this digital health. Although I think we were stupid, but we never utilized it before COVID. So it was COVID who made us understand that there are many things which can be done digitally. There are many things which can be taught, treated, and can be communicated through a platform. I will take you in, Sarva Saab, into a very high-level digital health task force in Pakistan. Amar Jafri, who was the first cyber security expert in Pakistan in FIA.
He is my cousin.
Okay, so then you know, and you just talk to him about me. Myself and Amar are working on a lot of projects of AI, as well as robotics, as well as a lot of community-based solutions. So what we are doing is we are first going to the communities, identifying their needs. What do they want? Because although the debate will change into something else, I don't want all the debate to be going on digital health, but just 2-3 points to you, that the patients, they are not satisfied in Pakistan like they are like a US or a Canadian or any developed country person will be satisfied just on a face-to-face app or on a platform on which he can see the doctor. No, in Pakistan, most of the physician, if you don't see the pulse, if you don't auscultate, if you don't examine them, you cannot get the satisfaction, or a health-seeking behavior cannot improve. So we are trying to get hold of the need of the patients in the periphery areas, and also talking to the doctors, because doctors are also against this digital health and digitalization of health, especially the consultation, because of the fee. They think that they will not be earning as much as they earn now. So because of that fear, so we are doing a lot of provider-based solutions and user-based, community-based solutions. And hopefully within next 3 months, we will be able to pilot some things, and we will be presenting it to the president, because he developed that concept and that TOR of the committee and everything. So the patient, the provider, the community leaders, and mostly the doctors, they have to be on board on those projects. So Amar Jafri, myself, Asfar, he was in Sehat Sahulat. So there are many new startups coming up. You know, there are many startups who are working on AI. You must be knowing Sohail Chughtai as well in UK. Sohail Chughtai.
G, I do, yes. I met him.
If I can tell you these names, you will understand that I'm already on to it. Now rest assured that Amar, myself, Sohail Chughtai, Asfar, and Zakiuddin in Karachi.
I know him too, G.
Yeah, so we are all on one forum. We are all on one place, and HSA is the center for all of them. And I have actually given them this assurance that financing, funding, research, everything will be supported by HSA. You just come up with a community-based solution. So I think you would be very good resource for that as well.
Thank you, sir.
Shahid, Danish.
Ji, I had one more question, if I may,
Sure.
Shahid Bhai, with your permission. The question actually was regarding the healthcare quality improvement, sir. The healthcare commissions I've had a chance to, in fact, spend a whole year in 2018 studying healthcare quality in Pakistan, and really did not get anywhere at all.
It is like
so yeah, so I in fact spent my lot of personal money in order to advance it, but did not succeed very much. So the healthcare commissions, how can the HSA help them with in enhancing healthcare quality? And I'm just going to say one comment and then I will stop. And that is, sir, जब तक हमारे ये हेल्थ केयर कमीशन की जो रिसोर्सेज हैं वो इंग्लिश में होंगी, it will exclude all the healthcare workers other than some of the doctors.
Yes.
And so वो बस वही कहने वाला.
आपकी बात सही है. अभी इस्लामाबाद हेल्थ रेगुलेटरी अथॉरिटी ने अपना चार्ज लिया है, कायद सईद साहब ने. जबरदस्त किस्म का उनका स्टार्टअप है, एचएसए उनका पार्टनर है उसके अंदर भी, क्योंकि हेल्थ केयर क्वालिटी देखें, पाकिस्तान में पहला जो कोर्स है ना हाई लेवल का, वो हाइडेलबर्ग यूनिवर्सिटी जर्मनी ने बनाया था क्वालिटी ऑफ केयर का, जब एमएसडीएस का जेसीआई का किसी को पता भी नहीं था. एंड आई वाज द फर्स्ट यू कैन से ट्रेंड मास्टर ट्रेनर इन हाइडेलबर्ग. सो मैं वहां से ट्रेनिंग लेके पाकिस्तान में हाइडेलबर्ग की फैकल्टी के साथ आया था 2007 में. तो 15 साल पहले हमने क्वालिटी की बात करना शुरू की थी. जब क्वांटिटी पे मसले बनते थे तो क्वालिटी की तो बात ही कोई नहीं करता था. तो उस वक्त सिल्विया सैक्स, काई स्टैटन रॉथ, बर्न एप्लेड, ये जर्मन साइंसदान थे हेल्थ क्वालिटी के, और EFQM का आपने नाम सुना होगा, यूरोपियन फाउंडेशन फॉर क्वालिटी मैनेजमेंट, उनके कुछ गुरुज हमारे साथ थे. वो पाकिस्तान आए थे और हमने पाकिस्तान मेड क्वालिटी केयर के कुछ मॉडल्स बनाए थे और केपी में टेस्ट भी हुए थे. और केपी के अंदर हेल्थ रेगुलेटरी अथॉरिटी काम करती थी उस वक्त, और किसी पाकिस्तान के सूबे में हेल्थ केयर रेगुलेशन का या हेल्थ केयर कमीशन का कोई वजूद नहीं था. सो वो हमने किया था, एंड वी डिड दैट, एंड वी वर लकी टू हैव अ वेरी गुड फीडबैक ऑन दैट. नाउ व्हाट इज बीइंग डन इज, आई विल टेल यू, the capacity building training, the development of clinical protocols, the development of you can say checklists, they are being taken up by HSA with some of the other parties. One is PNAC. There is a Pakistan National Accreditation Council as well. It is a government department. So Health Services Academy, in collaboration with PNAC and Islamabad Health Regulatory Authority, will take up this, and hopefully you will see within 6 months, I can assure you that things will be much better. The problem is with us. The problem is with the provider. Problem is with a lot of managers and administrators. They have no idea. There's two type of qualities. One is technical quality. The other is perceived quality. So we have to see both. We have to incorporate the patient satisfaction component into it. It's not just the machines and the processes which matter. So that is why we have to take care of these perceived as well as technical quality. And IHRA, Islamabad Regulatory Authority, there is a Twitter handle, there is a social media handles. I ask them to be open, whatever they do. And I'll just tell you one thing. Yesterday, the Islamabad Health Regulatory Authority presented to the Senate committee, because when this thing happened in the Noor Muqaddam case, the Jafar case happened in Islamabad, we were astonished to know that there are so many mental health quacks, you can call them, who are running businesses in Islamabad. And I tagged IHRA, and I called Qaid Saeed immediately the next day that, look, this, I don't want to name the company that was involved in his case, but I said that if they are not authorized, if they are not accredited, if they are not licensed to do that, if they are doing it, there must be others. Yesterday, just after, I think, maybe 2 weeks, the Senate Standing Committee chairman and all the committee, they had a briefing from the Islamabad Health Regulatory Authority, and they had complete census of all mental health institutes of Islamabad done with the report and with the recommendation. So if there is a political will, if there is a way, if the executive is interested, you can do that. And in the first instance, we are doing a census of all healthcare providers in Islamabad. It is 80% complete. And by all I mean the quacks, the homeopathic, the allopathic, the Chinese, the tabib, or जो भी आप कह लें वो पीर शीर दम वाले. We are doing and we are doing it through GPS, GIS mapping. So, and we have the coordinates with us. There will be a map of all the health facilities in Islamabad. Why I'm saying Islamabad again and again, if we can do it here, then we can go to Lahore, Karachi, Islamabad, and just it will be the replication of things. You have to showcase a model in an area where the stewardship is strong. The Hamza Shafkat is a great person, is a deputy commissioner in Islamabad. The way he worked in in this COVID, I am hopeful that he will be supporting us in this menace of poor quality care. Ji Shahid Sahab.
Ji. So let me bring for briefly other rest of our two panelists, because we have some questions from audience, and I'm almost
some I have replied, but others you can always ask. Yeah.
Okay. So Danish, do you have a comment? Then I'll go to our friend and brother Uzair.
Thank you, Shahid. I think Dr. Shahzad, being the chair of Merit Committee, I'm always wondering what are the ways we can collaborate, what are the ways we can support. Professor Sarwat ne baat ki, humne ye artificial intelligence and healthcare ki committee banai hai. And one of the things we're thinking that we need probably some initial introductory courses on AI in healthcare for our young generation students, healthcare providers, or providers in trainee for future who will be being exposed to this and probably need to have an understanding ताकि वो अपने software counterpart colleagues के साथ collaborate कर सकें. We have many such other courses that we're thinking about that we want to create, and we're looking for collaborators or platform where we can launch these kind of products. So your thoughts on what are the avenues or potential ways we can collaborate, our subcommittees can collaborate with your institution?
Yeah. I think you are already very good in family medicine. You are very good in critical care. But the one thing which we are struggling nowadays here is the GP model. Although when it comes to training of the family practice, it's okay. But GP as a gatekeeper to the insurance hospital, that model is yet to be tested in Islamabad. And of course in Punjab and in KP and all other areas, because we are opening up. Suddenly someday Khan Sahab may announce that we will also include OPD. So the way things are, we can have one day an announcement that also the OPD will be included in the insurance package. Currently we have indoor, so we have to be ready for that. This is something which you should be working on, the GP model, how to connect various GPs and pharmacies and all other. And I think Sarwat Sahab will be very good in that too, because he will have some models in his mind. Singapore is doing it, Korea is doing it, Taiwan is doing it, China has done in COVID. So IT based OPD consultation, digital health, plus the GP based model. After the training of family medicine, we train them in clinical thing, but the other things they are lacking. Number two is this artificial intelligence and healthcare informatics linkage with the all other aspects of health. We have vertical programs, we have data of HR, we have data of patients, the electronic records, the hospital records, specifically with the private sector. There has to be a way through commission, of course, through service commissions or healthcare commissions, we can do that. But we should be meeting separately. Danish, I think me, you, and all other partners over there, we can have a meeting exclusively for exploring various opportunity. But I'll give you the platform of HSA to do anything which you want to do nationally, because Islamabad is just one pilot. For the pilot, it is okay, but the real problem is in Sindh, in Punjab, in Balochistan, and in KP, in the periphery. So we should develop some good models of health service delivery, including IT system built in, and through the health seeking behavior of those areas, we should be replicating good models of East Europe or whatever they had been doing in the past, specifically in MNCH, in geriatrics, in elderly care, and some women-friendly initiatives. This is something which, but I think it needs exploration. Ji Shahid?
Ji. Thank you. So Dr. Uzair is with us. He is really a great mind and person in search of what we are doing, the collaboration,
I
connection.
was lucky to have a picture with him as well.
Right. So
I shook hand.
जो दानिश ने बात की है, I would ask the same question to Dr. Uzair to maybe tell us now, or maybe obviously in the interest of time, we probably should have a separate meeting for that. But Uzair sir, your comments on how we can collaborate with Shahzad and his team and HSA.
Thank you very much, Shahid, and welcome, Dr. Shahzad. Thank you for sharing your thought on such a short notice. And I personally witnessed your leadership style, and I still stand by my sentence that one man make the difference between ordinary and extraordinary. So each and every action speak volume about your strength and the management style. So that's really fantastic. Yes, we can do. I have just a quick two questions. First, you are going to have a session in September. That's going to be an activity. Is it going to be physical only or a mix of both?
It's hybrid. Yeah, it's hybrid. Yes.
Okay, that's great. And second is that you were privy to all the happening in NCOC and the COVID issue. It was the center of activity, Health Services Academy in immunization. Is there any appetite really to look into more detail about the vaccine production and develop some capacity, because that is in a very, very rudimentary shape so far? Do you have anything to say about that?
Yes. I think we are having a concentrate of CanSino bio, and even from the concentrate to the final production of injectable vial, it takes a huge process. People think that it's like a just वो कहते हैं ना concentrate को निकाल के तो उसको dilute करके तो बांट देंगे, वो वायरस है, आपको पता है ना, कैंसर के अंदर भी वायरल वेक्टर और ये सारा प्रोसेस है, और उसकी डोज भी आपने देखनी होती है. तो it's a very tedious process. Chinese were here for around 3-4 months inside NIH, and they actually did it themselves. उसके बाद उन्होंने पाकिस्तानियों को ट्रेन किया और खुद खड़े रहे हैं. अभी भी चाइनीज इंस्पेक्शन वहां पे होती है. लेकिन एक बात मैं आपको बताऊं कि they were very happy the way General Amir Ikram and the team took this challenge and started. We are producing 1 lakh doses per day, and for any country this is great. But the capacity can easily be enhanced. I'm telling you, the capacity can easily be enhanced to 2 lakh doses per day. And we are even thinking of exporting it to the Central Asian republics and Africa and those countries where there is a problem, and COVAX. And we are waiting for this WHO approval, which is at the 3rd stage, has been completed. CanSino Bio, the day it get approved in WHO, which is very near, Pakistan will earn millions of dollars in exporting this vaccine as well. Number one. Number two is there was an OJA Institute in Karachi, Dow University, OJA Institute. So we have been, by we, I mean the NIH team and the NCOC had been supporting them as well, and they have an excellent system over there. So if OJA also starts producing, NIH produces to 2 lakh doses per day, you can imagine how much money we will save by not importing anything and then exporting the COVID vaccine, which will be used for the next maybe few years. We are not seeing this disease going by just 1 year. Maybe it will reduce, it will come up again and go back, but next 3-4 years are very critical, and vaccination is the only solution to date. So yes, if there is anything going on in the US and Canada, I can connect you with General Amir Ikram. He is with me in NCOC and an excellent personality. And now he has reformed NIH into a fully fledged autonomous center for disease control as well. And your colleague in Canada, Dr. Zulfikar Bhutta, is having the chairman of the governing board. So you can see NIH in a very safe hand. In fact, safe hands. As far as I know, it's not just COVID vaccine. If you can develop a COVID vaccine here, you can develop any vaccine in NIH. Then there is no need of getting any vaccine from Gavi or anybody else. In fact, you will be producing vaccine and selling it anywhere.
Thank you.
Shahzad, and last, I think I will read these questions, and in Q&A probably they were not answered. So that would be the end of our program in next 5 minutes. One question, these are mostly from Fauzi and Sadiq and one or two other people. Have you digitized immunization data, and have you made a database of all trained people? And you know, first these two. Is there a database?
The answer is yes. The answer is yes. The USA Deliver had a very good software. They supported us through their delivery project, and then there's a GHSA. Dr. Tariq worked a lot. They converted all that data into real-time MIS systems. We have the inventory digitized. We have the doses, the number of doses given, which dose was given. So we are quite ahead in vaccine data. We call it VLMIS, Vaccine Logistic Management Information System. So each tehsil, UC, and BHU, and almost all the district level facilities are covered up. The next question was?
Okay, the next was the database of all trained people.
I showed you the vaccinators training is currently going on in HSA as well, on multiple things, including this digital entries and all these things. You know, the COVID vaccination is being done by vaccinator and the same EPI staff. We didn't get more staff. The same staff is being deployed, and you are giving 1 million injections per day. It's a huge thing. One cannot imagine Pakistan going to 1 million injections per day of COVID. It's a very big.
Yeah, that's great.
EPI has expanded the storage capacity. EPI has expanded this vaccination capacity, and the training of vaccinators through the UNICEF is taken up by EPI with HSA. And we are doing it even in the COVID times. Serious high burden of COVID in Pakistan. The trainings were going on here, of course, through SOPs and others.
Okay, great. Is there a Children of Pakistan project? They wanted to know more about Children of Pakistan project.
Yeah, if they go on the website, all the projects of HSA are there on the website of HSA. The child project, the ELBS study with Cambridge, Oxford, and a lot of other projects. They are all, and there are many publications as well which are attached to that. When I showed you the presentations, I showed you Seham Sikandar's articles. They are mostly on ELBS and mental health. So he's heading 2 cohorts. He's currently in London School, and also faculty at HSA as well. So he's doing a sandwich approach, research here and teaching and research here, and teaching and research there as well. So he's currently in London. He was here in Pakistan. But you can Google Seham Sikandar, and you can also go to HSA website and see the detail. And my email can be found. I wrote it here. I think I can write again for everyone. My email, you can always email me. It's not like that कि आप आज जो है सारे जवाब हमने आज ही देने हैं. Although
नहीं, ये तो connection चलता रहेगा. After that, the last 2 questions are one I can obviously maybe try to answer from Yazan Shahid. He says you have some collaboration with the Netherlands ambassador and other areas. What about UK and US healthcare centers? Is there a collaboration there to for the exchange program?
Bilkul. So maybe you can answer this.
Right. So then, I mean, from your side, we can identify people in public health, and also we talked with Sarwat Saab to I think from US we can have many programs with HSA, that no doubt, and that would take another meeting, which we can.
Like I mentioned, the GP model, the family medicine, the critical care, the emergency medicine, which is, and then there is the health, all of these, and of course the insurance things.
Right, exactly. So the Asif Aslam says that, do you have MPH program online? What about practitioners like him who are busy in their practice and cannot come for 1 year?
No, we have a diploma in public health. So for physicians, I think it's good enough. MS is not needed by everybody. You know, MS is needed when you want to do some research or join full-time as a public health professional. So I will encourage most of the GPs and doctors that all of them should do that diploma at least.
And
It's a
that's
1 year
online?
online. All of it is online.
Yeah, I
So-
think that's where we can also, collaborate with HSA.
Yes.
Anything that you need courses online,
Health
I think
insurance
we would be
management.
happy to bring the top faculty from North
Health
America.
insurance management, health
Yeah.
insurance management, diploma in public health, diploma in hospital and health services management, and GIS mapping and geographical information system and digital health. These are all online, and they are already available on HSA website, and admissions are open in that. And also somebody asked me, the MS public health and DS public health and online admissions are nowadays happening. Just go to the website. Everything is online. You just fill the form online, transfer fee online. There is no need to come to HSA from any part of Pakistan.
Gee. All right. So I think we are definitely, it has been one of the most popular programs, Dr. Shahzad, and I think it speaks volume about your presence and your name, that we had one of the largest attendance today. And it has really been enlightening and interesting. Obviously, we're running short of time, but like anybody who has question can forward their question, unanswered question, to appnamerit@gmail.com or directly to Dr. Shahzad. Thank you.
Thank you.
I could not get to Abdul Rashid and Ubaid Rahman in DRAP. For somehow they were not in panelists.
Abdul Rashid was telling about, Shahid, Abdul Rashid was telling about 10,000 AEFI collected through DRAP and submitted in Uppsala. So
Right.
he was telling that out of those 41 million injections, we have got 10,000 AEFIs.
Right. So I really appreciate both Ubaid Rahman and Abdul Rashid from DRAP to attending our, and next time, inshallah, we will have time for you. And we are honored that your presence in our webinar. Thank you, everybody. Assalamu alaikum from US.
Thank you. Assalamu alaikum, everyone.
Hafiz.